Susan, almost all of us know somebody who's had a stroke. Stroke is the nation's #3 killer. It's one of the leading causes of disability in this country. Joining us this evening to talk about strokes is Dr. Simon Fishman. He is with the Innova Health Systems. He also works with the American Heart Association. Dr. Fishman is a neurologist. We've all heard of strokes, but what exactly is a stroke, Dr. Fishman?
A stroke is a sudden alteration in the blood flow to a very specific part of the brain, causing a decrease of function in that specific portion of the brain.
President Ford and even the doctors who saw him at the hospital last night were not aware that he was having a stroke. How are we supposed to be aware when we're having one?
Sometimes the symptoms can be very subtle, but the important thing is for people to understand that any sudden change in their ability to move or sensation, vision, or balance could all be signs of a stroke. In that case, the most important thing is to get to a hospital as quickly as possible. And what we usually recommend is people call 911 rather than try to get there on their own.
And unlike with a heart attack, you do not recommend taking an aspirin if you think you might be having a stroke.
Well, things are evolving in stroke therapy. The most exciting portion of stroke therapy has been the use of TPA, which is commonly referred to as a clot buster. We can give it in the first 3 hours that somebody presents. One of the reasons the aspirin may or may not interfere with that is because we need to thin the blood to a certain level, and the aspirin may prevent us from being able to give TPA.
One of the most important issues in treating a stroke is timing, isn't it?
100%. The sooner you get to the hospital, the sooner an intervention can be done. Even those people who are further than 3 hours out from the onset of their symptoms, as most people are, because strokes occur at night primarily, but also can occur anytime during the day, need aggressive management of their blood pressure, their blood sugars, and the thickness of the blood.
So if there's any question in your mind that you might possibly be having a stroke, it's important to do something right away, isn't it?
Absolutely.
Are there things that you can do to prevent a stroke?
Absolutely. The risk factors for stroke are much of the same risk factors for heart disease. High blood pressure, cholesterol, diabetes. By managing these diseases, you lower your risk for stroke.
In a case like, and I know you don't want to really comment on former President Ford's condition because you're not one of the doctors who are treating him, but what's the outlook, generally speaking, for an 87-year-old who is suffering his first minor stroke?
Well, it all depends on where the stroke is coming from. Strokes can come from the heart, they can come from the blood vessels in the neck, or they can come from small blood vessels within the brain. Generally, people recover from stroke, but it all depends on how large the stroke was initially and where it was.
Okay, so only time will tell for
Exactly.
President Ford. All right, Dr. Fishman, thank you very much for joining us to talk about strokes, something we all need to know more about.